our nurses in the United States are really talking about, advocating for, that are important to the profession. And you see a lot written, a lot of proposed legislation to improve these particular areas of practice. So staffing. There has been a lot of conversation related to the appropriate level of staffing in a hospital setting. It's almost always about a hospital setting. And there is some states have passed mandatory minimum staffing ratios. So that means the number of patients that one nurse can take care of is in the law. It's legislated. So if I'm on a medical surgical unit, for example, a state may pass a law that says one nurse cannot take care of more than 5 patients on day shift and 8 patients on night shift. And that's the law. In other states, there are recommendations, but the state has not gone as far as to put that ratio into law. What those states and organizations have said is that the nurses to determine what the best staffing is for their setting. So if I'm on a medical surgical unit and my patients are not very sick, but they're still patients, maybe I only need 1 nurse to 10 patients because the patient acuity or how sick they are is low, and I have 2 nursing assistants to help me. That's a professional self-regulation or nurse-determined level of staffing that is based on what's happening in practice. So this is, I'm going to go to the next slide. This is an area that there's a tremendous amount of conversation about, and our executive leaders in the country are really promoting some sort of minimum safe ratio that says this is what the hospital in that state has to comply with. The challenge with the challenge with that, or the pushback for a minimum ratio, is that it doesn't allow the nurses to make decisions about their own practice. And that, by some nurses, is not seen positively. By other nurses, the minimum ratio is seen as very positive because it does not allow the hospital to go below that level of minimum safe staffing. And there is some research evidence that says patient outcomes are worse when you go beyond a minimum level. So this is a topic that's highly debated right now in the United States.